Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today. How much of a role does regular physical activity actually play? And in your suggestion, what type of exercise is best for hypertension?
Regular physical activity plays a major role in managing the hypertension, especially the aerobic exercises like cycling, swimming and walking plays a major role. Regular physical activity can decrease the blood pressure, systolic blood pressure by 5 to 8 mmHg. Daily at least 30 to 45 minutes of walking per day, regular physical activity per day plays a major role. And also strength training at least 2 times per week plays a major role in managing the hypertension.
This is the most asked question by our audience. Does stress really trigger hypertension, or is it just a common misconception?
Yes, stress is a trigger for high blood pressure, especially its effects on habits. Stress increases the blood pressure through the hormones like cortisol and adrenaline, and this stress acts on is the reason for the bad habits like smoking, inactivity, and overeating. This stress through this it can increase the blood pressure. The relaxation techniques for the stress helps in the management of hypertension.
Doctor, you just mentioned about relaxation techniques. So can we say that sleep also affects hypertension? And what should our patients know about sleep conditions like sleep apnea?
Poor sleep increases stress hormones and also blood pressure. Sleep apnea in particular causes a drop in the oxygen in the night, which causes a spike in the blood pressure. And sleep apnea is the most common underdiagnosed reason for the resistant hypertension. Especially the patient who wake up tired and also who are having snoring loudly in the night should evaluate for the sleep apnea, and the management for the sleep apnea like CPAP helps in the management of resistant hypertension in sleep apnea.
I would like to know, are there any new treatments or technologies which are upcoming you're excited about, especially for hypertension or cardiovascular prevention?
Yes, several treatment modalities and technologies have come. Among them, renal denervation is an important procedure. It's a minimal invasive procedure used for the treatment of resistant hypertension. And the smart BP monitors is usually they sync with apps and helps. They alert the patient about the blood pressure spikes. And polypills, they combine the multiple medications in one pill, helps in the patient adherence. Now research is evolving fast, and also this helps especially in individualizing the treatment for hypertension.
Doctor, you just talked about personalized treatments, and I think India is very heavy on it. So what's your take on it? Especially on practices like yoga, meditation, supplements, herbal remedies?
Yes, some do modestly. The omega-3 fatty acids, potassium-rich diet and magnesium can reduce the blood pressure. Yoga and meditation, they decrease the blood pressure by decreasing the stress, and they may reduce the blood pressure up to 3 to 5 mmHg. These are just supportive but not a replacement for the medications and the lifestyle.
So I would like to talk about the diet you would recommend to somebody, especially with high blood pressure. And can you also share us some meal tips?
DASH diet, it is a dietary approach to stop hypertension, is a gold standard. This diet contains, it is rich in vegetables, fruits, whole grains, and low-fat dairy products, and low saturated fats. And these easy tips like you have to swap the chips with nuts, use a lemon and herbs instead of salt, and you have to use whole grains.
We all know that people in India has a long family history of hypertension. Is there anything they can do proactively, even when they feel healthy right now?
They have to start healthy habits early, like they have to stay active, they have to eat a balanced diet, and they have to limit the alcohol and salt consumption, and they have to monitor the blood pressure even if they are young. The recent study shows that The lifestyle changes in a patient with a genetic predisposition for the hypertension can delay or even prevent the hypertension.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
Untreated hypertension can affect all organs in the body. It can cause stroke, it can cause heart attacks, heart failure, it can cause vision disturbances, it can cause aneurysms, and it can cause chronic kidney disease. If the patient hypertension is unmanaged for a longer period, the more risk and more damage it can cause to the body.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
For newly diagnosed hypertension or a patient whose blood pressure is uncontrolled, they have to check twice a day, once in the morning and once in the night. And once the BP is stable, they can check it 2 to 3 times per week. And blood pressure, measuring the blood pressure, they have to use a validated upper arm cuff, and they have to take at least 5 minutes rest before checking the blood pressure. And they have to avoid smoking and alcohol consumption before measuring the blood pressure. And they have to take 2 BP readings 1 minute apart.
Let's assume that somebody's blood pressure is coming under control. Can they come off medication or is it a lifetime commitment?
Sometimes yes, if patient loses a weight and lifestyle modifications are maintained, but for many it is a lifelong conditions. The goal is to use the lowest effective dose of medications and lifestyle modification to be maintained.
This is my last question to you today, doctor. If you can leave our viewers with the most 3 important tips for our heart health, what would they be?
Know your numbers, regular BP monitoring, and move more, eat better. Regular physical activity at least 30 to 45 minutes per day, and heart healthy diet. Stick with the treatment. Always follow up with a regular medication and follow with a doctor regularly, and don't wait for the symptoms. Prevention is always better, and you should not wait for the warning signs of the hypertension.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.